Hello and welcome back to our channel with a new video. Today we will discuss all you need to know about geriatric hip fractures. So without further ado, let's start with today's video. Each year, more than 300,000 elderly persons are admitted to hospitals with hip fractures, according to the Centers for Disease Control and Prevention. Accidental falls, most commonly sideways fall, are the leading cause of hip fractures. However, statistics don't make the injury any less frightening if it occurs to someone you know. What is a geriatric hip fracture? A hip fracture occurs when the upper portion of the thigh bone, or the hip joint, is broken. Geriatric hip fractures are hip fractures that occur in senior people, usually due to a fall. Unfortunately, as we become older, we become more vulnerable to new injuries resulting from regular physical changes, including weakening bones and joints, balance concerns, and muscle mass loss. Why are hip fractures in elderly adults dangerous? A broken hip in an older adult can result in life-threatening complications. The risk of death 1 year following a hip fracture can range from 20% to 30% in older persons. A shattered hip significantly hampers a senior's mobility. When older people are unable to move for an extended period, they are at risk of developing significant complications such as blood clots in the legs or lungs, pneumonia, urinary tract infections, bed sores. A broken hip in the elderly can also increase their risk of future falls and other fractures. How would a broken hip occur? A fall from standing height is the most prevalent cause. As previously stated, elderly individuals are fragile due to osteoporotic bone, poor balance, and a lack of good soft tissue coverage around the hip. Hip fractures can occur in severely osteoporotic individuals who are immobile while being turned in bed during the care provider's care. How can I avoid having a broken hip? If you are at risk for a hip fracture, you should avoid one as much as possible. The repercussions of a hip fracture are usually not in your favor. You can do few things to avoid this potentially life-altering incident. From our experience seeing thousands of hip fractures and hearing lots of stories about the mechanism, we will try to summarize few points. 1. Safe home environment. Make sure you have the right equipment for your needs and medical problems. A one-story house with no steps, for example, would be ideal. Your bathroom is also essential. You should be able to get in and out of your bath easily. If it hasn't already been installed, this can be costly. Remember, if you're thinking about it and can afford it, it's a good investment. Avoid using too many rags in your home, which could cause trips, and instead, choose a longer one-piece carpet that spans each room without any overlap or edges that could catch your feet. Make sure you have a light source near your bed and in the bathroom at all times during the night. Small plug-in lights assist you to see the first few steps till the leading light has been turned on. Darkness is your opponent at night, so be prepared and aggressive. Once you wake up, defeat your foe. It's just as crucial to have easy access to your home as it is to have a well-designed interior. Using a ramp, as few stairs as feasible, or an elevator to go in and out while avoiding stairs and uneven ground is a brilliant idea. 2. Walking aids. There's no reason not to use one. Please don't be embarrassed to use it. After all, it's your health and life on the line. Many families struggle to persuade their loved ones to use a cane or walker because they believe it is humiliating. Our patients with fractures, on the other hand, express regret for not employing one. To avoid a broken hip, you may only need to use a walking aid. 3. Clothes. Make sure you're dressed comfortably so you can move around freely. Long pants or skirts should be avoided because they can cause tripping and falls. Avoid wearing wide long sleeves that could get trapped in doorknobs or furniture, causing imbalance and a fall. 4. Pets and broken hip. We all love our pets and consider them members of our family, but be cautious. You can easily trip over your cat without even realizing it. We'd seen it before. Consider putting your pet in a safe area or even a cage at night. I would advise you not to walk around with your dog on a leash at the park. Dogs might become enthusiastic and drag you in an unexpected direction, resulting in a sudden fall. Please have someone else walk your dog. 5. Medications. The elder population always has a long list of prescribed medications, also known as polypharmacy. Some medications might produce dizziness, lightheadedness, and other side effects. Even though these medications are necessary to treat your underlying medical condition, they can lead to imbalance and fall, increasing your chances of breaking your hip. Please review your medications list with your doctor and bring up your concerns. 6. Wireless phone. Although we generally recommend keeping devices out of the bedroom, especially at night, and when sleeping, having one near your bed is a good idea. While you are still in bed, you may require assistance. Rather than struggling to take risky steps, contact someone who can assist you. All you have to do now is pick up your phone from the nightstand next to you and wait for assistance. 7. Lifeline, medical alert system. It is always available if you can afford it in case of emergencies. Which surgical procedure would be done for the broken hip? In general, there are 2 types of surgical operations for broken hips: fixing the fracture or replacing the hip or a portion of it. Percutaneous screws, dynamic hip screws, and intermedullary nails are used for fixation. Hemiarthroplasty or complete arthroplasty are the 2 options for replacement. Remember that the goal of any of these operations is weight bearing as tolerated after surgery, with no restrictions on activity. What if we decided to treat a broken hip with no surgery? That's not an option, as it means being in bed with no mobility and life-threatening complications. This is only for an extremely sick elder patient who cannot tolerate surgery after discussing with the surgeon and anesthesia team. This means letting the disease take its course and slow death, sadly. Hip surgery is recommended for hip fractures as soon as possible and optimally within 48 hours from the injury. Recovery from geriatric hip fracture surgery. After being admitted to the hospital, your loved one's recovery will be centered on movement, strengthening, and their general medical condition. With the support of physical therapy, assistive equipment, and their caretakers, patients are urged to put all of their weight on the operative leg. The pain from the fracture and surgery will progressively fade away over this time, and mobility should improve as well. Their orthopedic experts will see them 2 weeks following surgery to remove the surgical stitches and monitor their progress. At 6 weeks after surgery, X-rays will be done to assess the operative hip and advise accordingly. While the goal is to return geriatric hip fracture patients to their pre-injury level of function, this can be difficult for some in this senior group. Still, need more information on this topic? Don't worry. We have got you covered. Check out the links in the description box below to learn more about our resources and other helpful materials. Before you go anywhere, make sure to give our video a thumbs up and also subscribe to our channel and click on the bell symbol so you don't miss any of our intriguing videos. Stay tuned until next week.